Welcome to Med Madness, your go-to podcast for comprehensive medical knowledge. Today we're diving into a crucial topic, the relationship between peripheral estrogen conversion in adipose tissue and the development of endometrial hyperplasia and cancer. We'll explore how obesity and chronic anovulation contribute to these conditions and discuss key risk factors. Let's start by understanding the significance of atypical glandular cells found on a Pap test. When these cells are detected, it often raises concerns about potential abnormalities in the endocervical canal or endometrium. For women aged 35 and above, this finding necessitates a thorough evaluation including colposcopy, endocervical curettage, and an endometrial biopsy. Atypical endometrial hyperplasia is a precursor to endometrial cancer. This condition is predominantly caused by prolonged unopposed estrogen exposure, a common issue in patients with obesity or chronic anovulation, such as those with polycystic ovary syndrome or PCOS. Next, let's discuss the roles of estrogen and progesterone. Estrogen plays a vital role in causing the endometrium to proliferate, preparing it for possible implantation during pregnancy. Progesterone, on the other hand, counteracts this effect by down-regulating estrogen receptors and controlling mitosis, thereby decreasing endometrial proliferation. In ovulatory patients, increased progesterone levels help reduce endometrial proliferation, protecting against hyperplasia. Conversely, anovulatory patients do not experience a rise in progesterone, leading to unregulated endometrial proliferation and hyperplasia. Next, we'll explore the impact of obesity. Obesity further complicates this process through peripheral conversion of androgens to estrogens in adipose tissue, resulting in disproportionately high estrogen levels. This exacerbates the risk of endometrial hyperplasia and cancer. Other factors increasing the risk of endometrial hyperplasia and cancer include nulliparity, early menarche, late menopause, and tamoxifen therapy, which is used in breast cancer treatment. Consider the case of a 42-year-old woman who presents with abnormal uterine bleeding. She has a history of obesity and chronic anovulation due to PCOS. A PAP test reveals atypical glandular cells, prompting further evaluation. An endometrial biopsy confirms atypical endometrial hyperplasia. This patient's condition highlights the impact of unopposed estrogen exposure and underscores the importance of timely diagnosis and intervention. To wrap up, understanding the relationship between peripheral estrogen conversion and endometrial hyperplasia, or cancer, is crucial for effective diagnosis and treatment. Key takeaways include the role of unopposed estrogen, the impact of ovulatory status, and the significant risk factors involved. We encourage you to engage with our pre- and post-podcast quizzes and utilize the Anki Flashcards for a more effective and interactive learning experience. Thank you for tuning in to Med Madness. Stay curious and keep learning. For more lifelike voices, higher character limits, and dubbing content in other languages, head to 11labs.io.